Today, I would like to explain a very common condition in dogs, hind legs cranial cruciate ligament rupture. I understand that many of you may be feeling anxious after receiving this diagnosis from your veterinarian. I hope this time will help deepen your understanding of the condition and assist you in approaching treatment with a positive outlook. First, the cranial cruciate ligament is a ligament inside the knee joint that plays a crucial role in stabilizing the knee. When this ligament tears, it's called a cranial cruciate ligament rupture. However, unlike in human athletes where it's often a sudden injury from strenuous activity, this is rare in dogs. In most cases, the ligament gradually degenerates and weakens due to factors like aging, and eventually ruptures during routine, everyday movements. There are two particularly important points to know about this condition. One is that the ligament in the opposite leg is also highly likely to rupture. The other point is that the rupture is often accompanied by damage to the cartilage cushion in the knee, which can be a source of significant pain. Diagnosis is made by a veterinarian through methods such as physical examination and based on the diagnosis. Treatment options are broadly divided into two categories: conservative, non-surgical management, and surgical treatment. Conservative management is a non-surgical approach. It involves managing pain with anti-inflammatory medications such as carprofen or meloxicam, along with strict rest and, most importantly, weight management. On the other hand, surgical treatment aims to restore stability to the knee. The goal is not to repair the torn ligament itself, but to alter the biomechanics of the knee to create stability. Surgical procedures include extracapsular stabilization, which uses a special suture outside the joint to provide stability, and osteotomy procedures, which involve cutting and reshaping the bone to biomechanically stabilize the knee. Currently, one of these osteotomy procedures, the TPLO tibial plateau leveling, is becoming the mainstream choice because it is associated with a faster recovery and has been reported to have very good outcomes. This surgery involves correcting the angle of the shin bone with a plate to stabilize the knee during walking. Regardless of which treatment is chosen, recovery typically takes 2 to 6 months. And the most important thing to understand is that a knee that has experienced this injury will, to some degree, develop progressive osteoarthritis. Therefore, lifelong care through weight management, appropriate exercise, and supplements is key to supporting your dog's quality of life after treatment. If you have any questions, please do not hesitate to consult with our veterinary hospital staff